hi, darling. People are showing up.
Yep, they are. So you can see me and hear me?
Uh-huh, I sure can.
I can see you and hear you. Let me make you a co-host. Okay, yes. Okay, let me. Well, good morning, everyone. We want to welcome you to our webinar, our Zoom webinar for cyber mentoring for the month of March. We are going to talk today about the nursing pipeline from education to career. And we're going to welcome our two speakers today. We have Charmaine Bradford with South Texas College and Dr. Melinda Rodriguez with Doctors Hospital at Renaissance. Students, we're really excited to have you here today. I want you to notice that there is a chat feature that you're able to put in questions. And as Ms. Bradford and Dr. Rodriguez are presenting, I'll be watching the chat to see if you have any questions for them. Don't hesitate to run up to the computer and put any questions that you have. Also, to let everyone know that we are recording this. So we will make it available at a later time to anyone who wants to watch it again or show it in a different class teacher. So thank everyone for being here. I'm going to turn this over to Ms. Bradford.
Good morning, everybody. Let's see. All right, now I'm having to get this to work. Can you all see the pictures? PowerPoint? I'm not
hearing. We can, yes.
You can. Okay, let's start at the beginning of it then. Okay. Good morning, everybody. I would like to welcome you all to today's cyber mentoring session. And today we're going to talk a little bit about health careers in nursing. And we're going to start this out today with a little PowerPoint that explains a little bit about the different career pathways that you can follow when it comes to nursing. And by the way, did you know nurses can do anything? But why nursing? Well, because nursing is about helping people. The number one reason you want to become a nurse is because you care about people and you have an opportunity to make a difference every day in everything you do. You go in, you work with your clients and your patients, and you help them, and you make that difference for them every day. You can also be there for those who you love. If you are a nurse, you become the one that your family members look to for all those good informational tidbits to help them maintain their healthy lifestyles as well. Nurses can do anything. Nurses care for many different kinds of patients. They care for the elderly, sometimes very sick patients, including little children, and sometimes just really small patients. This picture is a picture of a nurse in a newborn nursery, a healthy newborn nursery, and she is doing a newborn well baby check on that little baby. Nurses can work in all types of environments. This picture is a nurse anesthetist in an operating room. She is the nurse who is responsible for keeping the patient asleep and safe while the doctors and other people are doing the necessary operations for a person's well-being. Nurses can do anything. They can work in places you know, like medical offices, hospitals, and schools. You all know your school nurse, I hope. If you don't, you need to go and meet her sometime soon because school nurses are absolutely awesome. And we would be in big trouble if we didn't have school nurses. Nurses can do anything. Maybe places you didn't even know about, like helicopters. I have a friend who is a rescue nurse. He literally goes in helicopters with his nursing team, and they go and fly out to accidents and rescue sites, and they literally pick up the injured and ill people out of the middle of nowhere and take them back to established health facilities and take really, really good care of them, keep them alive on the way. That's a biggie for a lot of people. Nurses can do anything. They can work in the laboratories. Research nursing is one of the newer branches of nursing, and it is becoming a very, very important aspect of nursing while we help other scientists and doctors discover all of the mysteries that we still have in medical health care today. Nurses can do anything. They can be on cruise ships. Can you imagine being on a ship with all those thousands of people and no medical personnel? Well, that's not going to happen because there's going to be nurses and sometimes even doctors on those ships to take care of you if you become ill or if you have any health concerns. Nurses can do anything. The military. Well, let me tell you, there is not I don't think there's any better way to serve your country than to be a nurse in the military. Not only are you helping lives every day, you are saving our soldiers who so bravely fight and take care of us every day. Nurses can do anything in jobs using computers and technology. This nurse is an ICU nurse. She's taking care of a critically ill person. If you'll notice, the patient has a breathing tube, has all kinds of IVs, all kinds of monitors. She's pushing medications for the patient. Highly trained, highly computerized and technological branch of nursing. Nurses can work anywhere in the world, anywhere in the world. United States nurses are sought after everywhere in the world. Now, there are several pathways to choose from to become a nurse. The first one is a certified nurse assistant. It's a 1 year full-time, then there's the 1 year full-time program, which is an LVN. Then there's 2 and 4 year programs that offer schedules that to meet your needs where you can become registered nurses. And remember, the more education you have, the more dollars you can earn. Now, a certified nursing assistant must have a minimum of 100 hours of training. They do take a state certification exam, and it's a 2-part exam. One part is a practical exam where they perform skills on mannequins in exam settings, and the other part is a written exam which they must pass to get their certification and become that CNA. Now, CNAs provide direct patient and client daily living care, but they do not necessarily give meds or advanced care. The next level of nursing, if you want to go up one, is the licensed vocational nurse. And by the way, STC offers a certified nursing assistant pathway. STC also offers a licensed vocational nurse pathway, which requires a 1 year full-time program. There is no other experience necessary. You don't have to have that CNA first or anything else. You can sign up and go to school, and in 1 year, you can be an LVN if you pass that, what we call the NCLEX. And for the LVNs, it's the PN, which is called practical nurse. Oh, by the way, if you hear somebody say an LPN or an LVN, it's the same thing. It's a licensed vocational nurse or a licensed practical nurse. They're the same person. They're just called one or the other in different states. Now, being an LVN does require direct supervision by a registered nurse, a PA, a medical doctor, or a dentist. And their salary is approximately $43,000 a year. Not bad for 1 year of school. Now, the next level up is the associate degree of nursing, which STC also has, and it is a great way to break into nursing. There are lots of scholarships available for nursing. It's also affordable if you're an associate degree nurse student and you need to get out in the workforce because you have to support yourself or a family. It's a great way to become a registered nurse in 2 years. And it's offered locally, like I said. And there are actually more than 65,000 associate degree of nursing, 65 associate degree nursing programs in Texas alone. So there's a lot of programs which tells you how popular this pathway can be. Associate degrees of nursing also, they take the same state exam, the NCLEX. You'll notice it doesn't have a PN after it. This is the full RN exam as the Bachelor's of Science of Nurses do. Now, staff nurse positions are where most associate degree nurses provide care. They do direct patient care and many other ancillary activities that all RNs do. Salaries average around $48,000 down here from the information I have found. But let me tell you, being an ADN is a super way to work as a registered nurse with the RN salary. And at the same time, you can go back to school and bridge to your BSN later on. Remember what I said about the more education, the more dollars? This is part of where it comes in. Now, the Bachelor of Science of Nursing is the next step up. On a traditional pathway, it takes 4 to 5 years to become a registered nurse, depending on the school you go to. There are lots and lots and lots of scholarships out there for nursing students. There's many huge corporations that have dedicated tremendous amounts of money to address the nationwide nursing shortage that we have. There are more clinical experiences for you if you become a Bachelor of Science Nursing. You are in the facilities more, and once you get out of or you finish your nursing student and become a registered nurse, there's many other experiences within the hospital that you can perform at a higher level. And you can bridge from the ADN to the BSN in as little as 2 years, like I said. The salaries now for BSNs down here are somewhere in the neighborhood of $56,000 to $64,000 a year. So you see, that's a step up from even the ADN. But again, that pathway, if you decide to take that side pathway, get your ADN first and become a nurse and practice as a nurse, and then in 2 years, you can get that BSN while you're working and making money at the same time. The BSN has some long-term career opportunities. They can become administrators and hold leadership positions. We have a lot of BSNs down here in the Valley that are charge nurses and head nurses and all kinds of leadership positions. Bachelors of Science nurses can pursue various nursing specialties like a certified recovery room nurse or a certified emergency room or a certified forensic nurse. There's a whole lot of nursing specialties that are available to BSNs. Then BSNs can advance to nurse practitioners as well, which is the next step up. Actually, it's the next step up. So beyond a Bachelor of Nursing, there's the Master of Science of Nursing or the nurse practitioner. Sometimes it's both. A nurse practitioner may require an MSN, which is 2 additional years, and then another certification of 6 months to 2 years more additional years. So you have your MSN 2 years after your bachelor's, and anywhere from 6 months to 2 years after that to get certain certifications. Having said that, some nurse practitioner programs are integrated into the MSN degree, which means some family practitioner programs in particular, when you get your MSN, you're also working towards getting your family nurse practitioner or pediatric nurse practitioner at the same time, and you can actually do that. It just really depends on what specialty you want to go into as a nurse practitioner, how much additional education is concerned. Now, more autonomy. Well, what's autonomy? I know you may have heard that word somewhere, but it's not a real common word. Well, autonomy mainly means that you have more of your own self-decision making, and you have probably had more training, and you have that ability because of that training and the legal ability to make those decisions for yourself and others. You are not so closely tied to physicians, although you still have a physician mentor. Now, look at this one. The salary for a Master of Science nurse practitioner, just generally speaking, $60,000 to $80,000 a year is a standard startup. Now, Masters of Science and nurse practitioners may also practice individually. They can have their own practices under the auspices of a physician. Nurse practitioners can prescribe medications to some degree. Different types of specialties of nurse practitioners have different prescribing requirements. Nurse practitioners are highly sought after to work in partnership with physicians and facilities as well. You don't have to go out and be a nurse on your own as a nurse practitioner. You can certainly work with doctors and hospitals. They just grab up the nurse practitioners as fast as they can find them. And nurse practitioners are the highest paid nursing professions. I said a little bit ago, $60,000 to $80,000 a year. That's a starting salary. And as you get more experience and more certifications, you can actually earn up to $125,000 annually or a year as a nurse practitioner. I didn't show you. Here is, I'm guessing this is a missionary nurse, because of his uniform. It doesn't look like a military uniform. It looks like a missionary uniform. And I suspect that's what he is as a nurse practitioner. And nurse practitioners deal with all kinds of patients, babies, and again, old people. And here's a whole group of young folks, and maybe not so young folks, who have just earned their nurse practitioner degrees. Now, there's one more step in becoming a nurse in nursing pathway. Finally, you can become a doctor of nurse practice or a doctor of philosophy. Now, these doctors are what I call book doctors. It's not a medical doctor, but at the same time, it's a doctor of nursing practice or a doctor of philosophy of nursing. And the difference between the two is that a doctor of nurse practice is a clinical practice degree, and their focus is in facilities working directly with patients or with administrative levels or policy making within the nursing world. The PhD nurses often become researchers or educational professors in higher education institutions. Now, if you want to get a doctor of nurse practice or a doctor of philosophy, it is going to take you 2 more years, just like everything else is going to take you a little extra. Hey, are you confused? Yeah, that's a lot in about 10 minutes, isn't it? But just remember, nurses can do anything. Here are a few websites that I have put up for you where you can find more information about choosing your pathway and finding scholarships. Remember, ADNs, LVN is 1 year, and an ADN is 2 years, and those are available at community colleges. Bachelor's of Science in Nursing is a 4-year degree available at universities, and these are the websites to explore. I was going to tell you something else. What was it? Oh, I better not. That may be a secret still, so I'll leave that one alone. So remember, if you want to be a nurse, nurses can do anything they want. And the more education you get, the better it is. So that's basically my presentation. It didn't take 30 minutes. So are there questions? I know that's confusing because there's so many subsets. Oh, by the way, there are over 100 different nursing specialty areas. So if you don't like direct patient care, there's lots of other areas you can go into. If you do like direct patient care, there's a lot of areas you can go into. So it's up to you, whatever you decide.
Let me remind students that we have the chat feature on the Cybermentoring. So if you have any questions for Miss Bradford at South Texas College, you can go to the computer that you're viewing this on and type in your question. It's available on the screen.
Okay. We have a little time. I have a little bit more. We can play a little. Do we have time to play a little? Okay. Hey, you know, when you're a nurse, you get to meet great people. And nursing's a lot of fun. Oh my goodness. It's a lot of work and a lot of stress, but it's also a lot of fun. Imagine doing what you love every day and getting paid for it. I don't know of anything any better than that. Nurses also work with others who want to make a difference in the world. Can you imagine working with people that love their job as much as you do? there's not many places where you can work where that happens. But in nursing, you find many, many people who have dedicated their entire lives just to helping other people live their lives the best they can. Nurses, in this day and age, you have schedules that even bend and flex. You can work a 12-hour shift and only work 3 days a week because that's 36 hours. And by the way, you work those 3 12s, you get the other 4 hours pretty much considered for free. So you work 36 hours, get paid for 40 hours, and then you have 4 days where you can go do other things like this dude's doing. I mean, you like to swim, surf, any of that stuff. You can go do that in 4 days. You can have a good vacation then. You can even go work while you further your education. So 4 days off gives you lots of time to go and do that homework that you would like to do. Nursing is your ticket to opportunities in emergency rooms. Think about that. I don't know if you've been into an emergency room or not, but emergency rooms are full of nurses. That's the primary caregiver when you go to an emergency room. And the doctors are there to provide the medical direction. And then the emergency nurses pretty much do it all. Pediatrics, everybody knows what pediatrics is. Those little kids, can you imagine helping some little child to go from desperately, critically ill to a healthy, well child who's going to grow up and be a wonderful person in someone's life? Operating rooms is a really, really special place for nurses. There are different areas even within the operating room. You can be a circulating nurse where you go around and you be sure that everything in the operating room is running smoothly. You be sure that everything in the operating room stays sterile like it's supposed to. You be sure all the instruments are counted properly. It's a very important job. Operating room nurses also often assist the physicians in their surgeries. Many operating room nurses get lots of extra skills and certifications and can do even more procedures with the physicians in the operating rooms. Then, of course, there's the nurse anesthetist in the operating room who is kind of like running the show, keeping the patient breathing adequately and sedated and being sure that everybody is safe. Now, I know you're familiar with your school nurse, but there are a lot of other school nursing too. There are more and more schools that offer nursing education at high school levels, just like your schools. And nurses are required for those positions as well as your school nurse. Now, the military, oh my, that's a whole huge discussion just by itself. There are so many opportunities for nurses in the military. You get your training. The military actually will take you and train you, and you will not have to pay them anything for the training. You do have to sign a contract to stay with them a certain number of years, depending on what level of nursing training you would like to have. And then once you finish your required military time, you can either stay in the military and go up through the ranks, or you can go back into civilian life and have a way big head start on a lot of the rest of your life. Community clinics are important places where nurses work. We have community clinics all over the valley here. We have public community clinics, the health clinics. We have private physicians' offices. We have emergency care centers, urgent care centers, just all kinds of community clinics. We have the VA clinics. We have the Hope Clinic. We have just a lot of different clinics where nurses are required and great places to work to help people to live their lives well. And so many more places. So some bonus points here for you. Educator, author. Author, how can a nurse be an author? Hey, have you seen those nursing books yet? Well, have you seen any kind of a medical book ever? Somebody has to write those. And if you look at nursing books, they're written by nurses. So there's a huge field if you like to write, if you are a nurse. Imagine being able to say, I was part of an authoring group that authored an entire nursing book for an entire world. That's pretty awesome. There's legal nurse consultants. Legal nurse consultants work closely with doctors and research legal issues within basically lawsuits. And they let the doctors know what is important, what is right. they find the mistakes that have been made, if mistakes were made, and then help the doctors, guide the lawyers actually, in how they should prepare their case. And they also even act as expert witnesses in many trials. Then there's the missionary nurses. Missionary nurses are found everywhere in the world. They can be through Christian organizations, or they can be through non-religious organizations. There's one called Doctors Without Borders that is worldwide, and it's comprised of nurses and doctors and other medical people from all over the world who have come together to go to remote regions of the world and provide desperately needed medical care. These are the people that are on the front lines, literally, of many war zones, and provide just the most amazing care to the local population in those areas. Did you know, going to the next one, physician, that the nurses can go back and become physicians? That is a separate pathway that nurses can follow if they like. And that is an option for nurses to consider if they decide they want to go further in their degree. Now, an entrepreneur, how can a nurse be an entrepreneur? By the way, what's an entrepreneur? An entrepreneur is a person who goes out and does something on their own, and typically they create their own business. And entrepreneurs can successfully create a business, and they end up having a very nice income and be the boss at the same time. Pretty nice, huh? You can have, as a nurse practitioner particularly, you can have your own clinic. A lot of, some nurses even go out and start CPR businesses, where what they do is they teach CPR to whoever wants to learn CPR, and they make a living doing that. Or they can do it on the side and work somewhere else as well. Then there's forensics in nursing. Do you like a good mystery? Did you ever think about it? What do you think healthcare is but the biggest mystery of all? Everything we do in healthcare is to help solve those mysteries and help those patients become better people, healthier people, so they can live their lives well. And forensics is often a very important. How are you going to find out? How are you going to know what to treat if you don't know what's wrong? Got to figure it out. And that's forensics. And then there's the neuroscience group. Those people are on the forefront of nursing healthcare. A lot of the neuroscience is in research right now. And if you like the brain and you like science and you like electricity, that's the place to be. So, pop quiz. Question, do you know a nurse? I know a lot of nurses. What about you? Can you guess which one of these people is a nurse? The lady in the red suit? The guy in the beige suit? Oh, we know that one's a nurse, right? This lady? Oh, well, maybe a nurse. I don't know. And who's this guy in a suit? Figure him out. You ready? That lady's a nurse case manager. Oh, yes, that's an important part of nursing. We have to have, in this complex world, people who help us go through, navigate the incredibly complicated maze of healthcare. Then there's the diabetes nurse, the nurse anesthetist again, a nurse consultant, which can do a lot of different areas, the nurse researcher, and a nurse educator. So nurses look a lot of different ways. So how do you get started? You ready?
I wonder if Med High wants to ask a question or tell us, do you know a nurse?
Yes.
You do? How many nurses do you know at Med High? That's what I thought. I see we have Miss Ramirez's class. We have Miss Zambrano, Miss Barrera, Miss Garza, Jay Cantu, Miss Stefino. All of you, we're waiting for you to ask questions. Med High, do you guys have a question for Miss Bradford? You unmuted your mic, so I wondered if you had a question.
Not right now.
Okay, not right now.
Okay. Uh-oh. So, You want me to continue a little?
Yes.
It's about time. I can just tell you a little bit. Here, you need to do the best you can in school, and a little math and science is important, guys. It really, really is. So do your best you can in school. Did I hear a question?
Yeah, I don't know. Do you have a question? Go ahead.
I actually have a question. How long, how many years do you have to study for becoming a nurse?
Well, that's what I had gone through here a little bit, but let me recap it for you so it's a little clearer, because it's pretty confusing. You can, depending on what kind of nurse you want to be, is the rest of that question. If you want to be a CNA, that only takes a few months. If you want to be an LVN, that takes a year of full-time school. If you want to be a registered nurse, there's two ways. Actually, there's three ways. One of them's going away, so I'll just talk about two. But the two main ways to become a registered nurse is through an ADN program, which is an associate's degree nurse. And that's a 2-year program where you become a nurse. You take the same state board as the other nurses and pass it, by the way. And then you work as a registered nurse. Then there's the 4-year Bachelor of Science nursing program, which is 4 to 5 years of college as a student nurse. And then you go in and practice as a registered nurse. So those are the primary initial nursing pathways. There's also the med tech, and they work in doctor's offices primarily, but I didn't put that one in this presentation. So that's the basic starting spots. A lot of people are becoming ADNs first and then moving on. They're working full-time as registered nurses as an ADN. And then what the DHR is going to talk about is how you can progress through the different steps if you want to go up that ladder in different kinds of nursing careers. And working and going to school at the same time is a challenge, but oh my, what an awesome challenge it is. So maybe that clarified it for you just a little bit.
Yes. Thank you. Thank you.
Do we have any other questions? Just a moment. I see over in the chat that we do. It said students in high school who take CNA courses, do they have an advantage over normal students, specifically when these students are applying for STC nursing programs? This is from the Academy for Health Science Professions in La Jolla.
Okay. If you become a CNA in high school, there are some few colleges who will take that into consideration when you go into the nursing program. But officially for credit, most high school programs are not carried over into the college area program. But let me tell you, unofficially, it's an awesome thing to have. Because if you're already a CNA when you start nursing school, you are so far ahead of all of these other people who come in. They've never done anything. They don't even know what a normal temperature is, most of them. You've already got all that. You're way far ahead of them. And getting it in high school, it's like free. Well, that's an important part. When you go to college, then it has to get paid for somehow. And while you may get a scholarship, your parents are going to be thrilled that you don't have to pay for any part of that college experience. So getting it in high school is a really, really important head start step to take. Did that answer your question?
I think so. I think at this point we're going to, if you could give us back control of the computer.
There you go.
There. And now we're going to welcome Dr. Melinda Rodriguez. Dr. Rodriguez is with Doctors Hospital at Renaissance, so let's give her a big welcome. Thank you, Dr. Rodriguez. Continue.
Garrett, hi everybody. I'm glad to be here. Ms. Bradford, that was an excellent presentation, and it's an excellent way for me to get started to talk to you about the different types of nursing and the different steps that you can take to become a registered nurse. And I'm going to start with that question that was asked a little bit ago about the CNA. In some programs, unfortunately, they don't really give you credit toward getting your ADN. However, the best part about becoming a CNA and then going into the ADN is that it allows you to give you that bedside experience where you can work with the patients. You're able to assist with patient care, bathe your patient, do vital signs, take their blood pressure, have that relationship with the patient. It really gives you a firm foundation. It also prepares you if you do decide to go into the LVN program. I used to teach in an LVN school back in Corpus Christi, and I taught LVNs for 2 years. And I feel, in my opinion, they're the foundation of nursing. They do a lot at the bedside. They assist the registered nurse with patient care. And then moving forward, it prepares them and gives them confidence in practice so they can go into the associate's degree in nursing program, which is 2 years. The associate's degree nurse is a bedside nurse. They also do management, as Ms. Bradford said. And they also are administrative. They have an administrative piece. They work collaboratively. And I'm going to bring out a new term for you all so that you can understand that healthcare now is a multidisciplinary process. So when we say multidisciplinary, it means that we work with other nurses, we work with physicians, we work alongside physical therapy, we work alongside case managers, social workers, and or nurse case managers. We work alongside occupational therapy, dietitians, and what we try to do is to provide a holistic plan of care for the patient that includes all of these disciplines. So we're looking at a more multidisciplinary approach to healthcare now, and find that the patients have better outcomes when we do, practice that way. But when you go from CNA, and I'm going to go again, and I'll tell you a little bit about my history, because I was a candy striper. I've been in nursing for 40 years, and I don't know if you can see my gray hair on the video, but I've been a nurse for 40 years. I was a candy striper in Corpus Christi, Texas, and back then candy stripers dressed with a little candy striper outfit, and I think the thing that excited me the most is that I could wear a little cap. It made me feel like a nurse. But back then we would help with bathing patients. We passed out water. We actually transported patients in wheelchairs. We worked with family members, and it really inspired me to go into nursing. I did start school. I graduated from high school and went straight to Texas Women's University in Denton, Texas, where I got my Bachelor of Science degree. I was very young, and when I finished my Bachelor of Science in nursing, I didn't want to go to school anymore. I felt like I'd done enough and I wanted to work. But later on, I got married, I had my children, and then decided when I moved to the Valley to get a master's degree. So as Ms. Bradford said, I did get a Master of Science degree in nursing, and I am a family nurse practitioner. Family nurse practitioners, you have advanced practice nurses that can become family nurse practitioners, CRNAs, or certified nurse anesthetists. You also have your gerontology nurses that are nurse practitioners that work with the older population, pediatric nurse practitioners that can work with your pediatric patients. So becoming a nurse practitioner for me was so exciting because I was able to do direct patient care. I was able to assess the patients. I could prescribe medication. And here in the state of Texas, we have a collaborative practice with a physician. We don't have autonomous practice, so we cannot practice yet by ourselves. We have to be overseen by a physician, but you work in a collaborative relationship with a doctor. So then after that, I got the bite to go back to school. Now, granted, folks, you guys are young. I was 44 years old when I got my master's degree. So it does prove that you can do it. It doesn't matter your age. I went back and I thought teaching at UTPA, which is now UTRGV, they encouraged me and they helped me, mentored me to get a doctorate. So I have a doctorate in nursing practice, which is a clinical doctorate for nurse practitioners. Now the DNP is also a doctorate degree that can be given to other disciplines. Nurses that work in leadership, nurses that work in the hospital setting, that have a master's degree can get a DNP. And I taught nursing. So I love that. I love teaching nursing. And so I just want to tell you that you can do whatever you want to do if you set your mind to it. There are programs that are online. You also have UTRGV here. You have STC where you can get your associate's degree in nursing. And they soon are going to have a bachelor's degree in nursing program. I believe next year they're going to start the Bachelor of Science in Nursing program. So you have a lot of options. But let me tell you that if you love nursing, the passion for nursing is the patient. And if you have that passion to help patients, that's what's going to motivate you to go above and beyond and get your degree in nursing, or get your associate's degree in nursing, or even become an LVN. So you can see you can go from CNA to become an LVN. As an LVN, now there are programs that are LVN to BSN. You have programs that can take you from an LVN program straight to a BSN. And then you can go from a BSN to a DNP. So there are now programs that you can go from having a bachelor's degree, eventually along the way get your master's, and become doctorally prepared with a doctorate in nursing practice. So,
Dr. Rodriguez.
Yes.
The Academy for Health Science Professions has a question for you.
Right.
They say, what would you say would be some of the characteristics or personalities that students should have when applying for any type of nursing program, such as hard work, professionalism, etc., whether it's CNA, LVN, or going to the university? What ideas can you share with them?
I can tell you that from personal experience, that what motivates anyone who wants to go into a healthcare profession, whether it be nursing or any other healthcare profession, is the passion and the love that you have for helping others and taking care of patients and their families, because it's not just the patient. You have to include the family in the care. So if you have that passion and you want to help people and you have the passion to help people, I think that's the first step. Surely you have to have a working relationship and a professional relationship with your peers as you work in this profession. But I think above all, just the passion to serve and to help others. When you graduate from the nursing program, I know at UTPA, UTRGV, we recite the Florence Nightingale Pledge. And basically it's pledging to take care of our patients. So if you have that desire, the world is your oyster. You can do whatever you want to do as long as you have that desire to help others and to have that empathy and care for patients. That's the only thing that I can think of that you have as a characteristic. Surely you have to have good people skills, and you should be able to communicate effectively. That's all important too.
They're also asking, what should high school students do as of now to prepare to make them excellent applicants when they go into nursing programs?
Let me tell you the important thing. This is one of the things that I've seen as I've taught. I've taught for well over 20 years. Time management. Being able to manage your time in that your studies have time to study. There's time to study. There's a time to play and have fun. There's a time to rest. There's a time to eat and sleep. I think managing your time wisely now with your assignments and what you're doing in school so that you can work on getting the best grades that you can now will prepare you for college. It'll prepare you for becoming an LVN or becoming an associate's degree nurse or a bachelor's. You just have to be able to manage your time. I think I learned this, the best way I learned this was when I was working toward my doctorate, where I was working. Some of us may have to work. And if you have to work, that's okay. But you have to, even more so, be a good manager of your time. When I was tired, I would close my books. I wouldn't read anymore, but I would spend 2 or 3 hours a day studying. And then the rest of the time, I could plan on maybe having some activity with my family or just watching television. But I think right now, you need to learn how to manage your time and to put your focus on your studies and just do the best that you can to make the best grades possible. That'll prepare you for college and prepare you for nursing school.
Thank you.
I wish I were there in person so that I could talk a little bit more. I have a daughter. I'm very proud of my daughter. I didn't encourage my daughter to go into nursing school, but my daughter is a nurse, and she got her Bachelor of Science degree from UTPA and got a Master of Science degree in nursing from UTPA, and she's a family nurse practitioner. And so there are lots of options. I was a school nurse also for 11 years when I worked in Corpus. So I loved working in the schools with the students. There was always something new, and my experience, we have little minor emergency rooms in the schools. And so we're able to see different types of patients, different types of students that come in with different types of situations. And so I really loved working in the schools. Are there any more questions?
It doesn't look like there are. Can you tell us a little bit about Doctors Hospital at Renaissance and the different types of positions that they have there? Because I think it's a pretty typical hospital. I think it's probably a more expansive hospital than what students have experienced. So if you could tell us a little bit about that.
Yes, Cindy, yes, I will. Doctors Hospital at Renaissance is now a health system. I've been here at this hospital now for 4 years. I came straight from UTPA, and we do have approximately 1,500 or over 1,500 nurses working here in our facility. We also have outpatient clinics where we do have some LVNs that work in our outpatient clinics, but we have different service lines, different specialties. We have the operating room. We have nurses working in the operating room. We have nurses working in radiology. We have telemetry, emergency room, surgery, if you like surgery. We also have nurses that work in medical surgical units. And so we're expanding. We are encouraging our nurses. We have nurses that have associate's degrees in nursing. We have nurses with Bachelor of Science degrees in nursing. We have some in master's, currently working on their master's degree. And as we speak, one of our directors of our medical surgical unit here in the North Tower at DHR is testing for her family nurse practitioner certification. So I'm hoping these are prayers going Sandra's way. I know she's going to do well. So we have nurses of various educational levels, and we do try to promote and encourage professional development along the way, because education is something that they can take everything else from you, but they can't take your education away from you. So we really try to encourage that. We are expanding. DHR is expanding. We do have advanced practice nurses and physician assistants, which is another healthcare track. Physician assistant programs. We have one here at UTRGV, and we have them working in our ambulatory clinics. We have 2 school-based clinics, one in PSJA and one in Edinburgh ISD, and soon to open, I believe, another one in Weslaco. And we have advanced practice providers working there, advanced practice nurses. We have some in the emergency room and the urgent care center here at DHR. We have an urgent care center here at DHR. So there's a lot of opportunity. So if you go to school and you become an ADN, LVN, Bachelor of Science in Nursing nurse, we want you. We'd love for you to come and work here at our facility. I'm sure we'll have plenty of opportunity and plenty of room and positions for you. We're a great place. We're growing very quickly.
Well, we feel very fortunate to have both South Texas College and DHR as our partners for Project HEAL. Students, I want to open the floor to you then. We have some more time, and if you have any questions, please send them through. I do have a question here from MedHigh. Hi, MedHigh. It's saying, do you have any forensic nurses, and what is their role?
Yeah, so I'm so glad you brought that up. I was trying to write some notes here so I wouldn't forget. Yes, we do. We have our sexual assault nurse examiner program here at DHR. We've had it for the last 2 years. Yvonne Garcia is the director of this program. We have 4 certified sexual assault nurse examiners. These are registered nurses that have gone back to school to receive that certification. They are on call 24/7 here in our emergency room, and their role is to see any patient that might be a suspect for sexual assault or even domestic violence. And so they did get specific training for their role. And really the department and the service line is really expanding and growing. So there is a role. Forensics is the hot topic these days. And so I know Yvonne Garcia, maybe one day she can come and do a little bit of cyber mentoring, so you can speak with her, because she's got a lot of experience in this field. And Sandra Munguia and I were just talking a little while ago and saying, you know, this has got to be really sometimes very heart-wrenching and depressing to have to deal with this population. But these nurses are so well prepared, and they do just a fabulous job. So yes, we do have a sexual assault nurse examiner program here at DHR, and we currently have 4 certified nurses.
Med, hi, I see you've unmuted your microphone. Do you have another question?
No, thank you.
Okay, not right now? How about Miss DeFino's class? I see you all there. Hi, guys. Hi, Miss DeFino's class. Does anyone have a question? No? Miss Cantu's class, I think the bell rang because it looks like they're leaving. How about Miss Barrera? Does anybody there? Hi, guys. Do you have any questions? I think we have answered everyone's questions. I want to thank Miss Bradford and Dr. Rodriguez. Oh, do we have a question in Miss DeFino's? Go ahead, ask your question.
I wanted to ask, how's the demand for nursing? Like, I don't know, I mean, is certain areas like they need more, or like in certain areas, I don't know. How's the demand?
That's a great question. What is the demand for nurses?
A big demand. A big demand. You will always have work. You will always have a job as a nurse and in any healthcare field, because there will always be sick people. And so it's just choosing what area or what expertise in nursing you want to work in, but there's always a demand for nurses. Sometimes there have been shortages in the past where we've been looking for nurses. We definitely are looking for nursing here at DHR. So there's a demand. So anything in healthcare, especially in nursing, you'll always have a job. There won't be any issues with you having a job, and you'll be able to pick the type of job you want and the hours that you want to work. That's why it's flexible. As Ms. Bradford said, you can work 3 12-hour shifts or 4 12-hour shifts and be off the rest of the time. We have nurses here at Doctors Hospital that work 3 days here, and some of them work 3 days at another facility, so they can get a week's worth of hours. So you have that flexibility, so there'll always be work. There'll always be work for nurses.
Just to let you know, students, that's one of the reasons we have the Project HEAL program, is so that we can increase the number of students interested in the nursing field and going to South Texas College to start their education, and then going either to DHR or to any of the other fields we've talked about today. So we're excited to have you as part of the program, and we're hoping to see a lot of you enter the medical field, because we do need nurses and other medical professionals, not just in the Rio Grande Valley, but other places in the United States.
Ms.
Do you have any other questions?
Ms. Gutierrez.
Yes.
I just want to point out one thing that we haven't really said much about, and that is mental health.
Oh,
that
good.
Is a huge area that is available in nursing. I know people usually think of psychologists and psychiatrists, but there's mental health nurse practitioners, there's mental health nurses, and I don't want anybody to go away thinking that nurses don't work with mental health, because that's a huge area and it's becoming a more expanded area every day. So any of you guys that like mental health and psychology and all that, we have a career for you in nursing.
Thank you.
And that's very well. That's very well said, Ms. Bradford, because UTRGV has just graduated their second cohort of mental health nurse practitioners. So there is a nurse practitioner program for mental health providers, and so UTRGV has that available.
Ms. Tofino's class, did you have a question? Well, Ms. Bradford, I want to thank you for joining us. Dr. Rodriguez, I want to thank you for joining us. Students, it's been great to have you here for our cyber mentoring schedule. If I think that's it, we're going to say goodbye for today, and we hope to see you again the next time we have cyber mentoring. Thank you very much, and goodbye.
Bye.
Thank you.